नमस्कार। रिहैबिलिटेशन काउंसिल ऑफ इंडिया के नवशिखर चैनल में मैं आप सबका स्वागत करती हूँ और सबको नववर्ष की हार्दिक बधाई देना चाहती हूँ। आज हम चर्चा करने जा रहे हैं विजुअली इम्पेयर्ड लोगों की। इसमें हम बात करेंगे सबसे पहले एक इंट्रोडक्शन टू विजुअल इम्पेयर्ड एंड उसके बाद कॉजेज, प्रिवेंशन, अर्ली आइडेंटिफिकेशन, असेसमेंट और मैनेजमेंट के बारे में बात करेंगे। इस विषय पर हम संक्षेप में पहले 20 नवंबर की टेलीकॉन्फ्रेंस में चर्चा कर चुके हैं। आज हम इसी को डिटेल में बात करेंगे। विषय पर चर्चा करने के लिए आज हमारे साथ डॉक्टर गीता माथुर नेशनल इंस्टीट्यूट फॉर विजुअली हैंडीकैप से देहरादून से मौजूद हैं स्टूडियो में। मैं मैडम का स्वागत करती हूँ। और डॉक्टर माथुर बेसिकली इन्वॉल्व है असेसमेंट और मैनेजमेंट ऑफ विजुअली हैंडीकैप NIVH में। ये वहाँ पर लेक्चर्स भी लेती हैं वेरियस कोर्सेज के और पार्टिसिपेट करती हैं सेमिनार्स, वर्कशॉप्स और वेरियस कॉन्फ्रेंसेस में। बेसिकली उन्होंने बहुत सारे कोर्सेज किए हैं। बेसिकली फिजिशियन है पेशे से और बहुत सारे कोर्सेज कर चुकी हैं फैमिली प्लानिंग पे, फैमिली वेलफेयर पे, हॉस्पिटल एंड हेल्थ मैनेजमेंट पे। तो आज हमें ये डॉक्टर गीतिका माथुर हमें बताने जा रही हैं कि विजुअल इम्पेयरमेंट क्या है और आई के बारे में भी हमें डिटेल में बताने जा रही हैं, आई की एनाटमी के बारे में और विजुअल इम्पेयरमेंट के क्या कॉजेज हो सकते हैं, किस तरह से उसको प्रिवेंट किया जा सकता है, उसकी असेसमेंट, मैनेजमेंट किस तरह से की जाती है, आज हम ये जानेंगे। आइए मैडम शुरू करते हैं प्रेजेंटेशन।
थैंक यू सोनिया। आज आई एम वेरी हैप्पी न्यू ईयर टू ऑल ऑफ यू एंड आई एम सो हैप्पी that I'm here today and I'm ready for a two-way kind of interaction with all of you. I hope whatever kind of misnomers or any kind of confusion which is there in your mind regarding visual impairment, I'll be able to clear all that and I'll be able to impart some knowledge to all of you. I'm here, welcome all the viewers and a very good afternoon to all of you. I'm very thankful to the Rehabilitation Council of India who have invited me today and has given me this opportunity to talk to all of you, and I'm also very grateful to the director NIVH and my institution which has given me this a good platform where I can talk about visual impairment to all of you and I'm able to help you out or make you impart some knowledge regarding visual impairment. I wish this will be a very beneficial kind of a topic for all of us. I want a two-way interaction. Hopefully, it should be that kind of a good kind of interaction between everybody. So, should we start, Sonia?
Yes, we can start.
So, we will. I'll talk to you about the anatomy of the eye first. As you will see here in this slide, there are various organs which are involved in the formation of the vision in the eye. The first and the foremost which we come across is the cornea. The cornea is the outermost part of the eye which acts like a window. As we go behind the cornea, there is another structure which was known as the aqueous humor. The aqueous humor is the second portion which comes into the vision, in the path of vision. Followed by that is the pupil, and behind the pupil is the lens which you can see as a white object, and it is marked as the lens over there which is crystalline in its shape and size and in its structure, and just behind that is the vitreous humor which is followed by the retina. On the retina you can see there is an area which is known as macula and which is where the image formation takes place. From here, all the images are taken up by the optic nerve, and from the optic nerve it reaches to the occipital part of the brain. As we go ahead, I will talk about each of these organs one by one. We talk about the cornea first. The cornea is a transparent, absolutely transparent dome shaped structure, and it is the outermost part of the eye. It's a window which covers the front of our eye. The cornea does not have any blood vessels and it is very clear and shiny. It is extremely sensitive due to the number of nerve endings, and it is about 0.5 millimeter in thickness. It is used for corneal transplant, and it is a kind of a misnomer when people talk about, say they when they talk about eye donation. It is this part of the eye, the cornea, which is transplanted from one person to the other. The cornea, one has to appreciate that there is no blood vessels, and there are number of nerve endings that are really very high. Now why it is so, you will realize that the blood is absolutely opaque. मतलब कहने का ये तात्पर्य है कि अगर कोई भी चीज उसके रास्ते में आती है, ब्लड अगर है, तो उसके थ्रू लाइट पास नहीं हो सकती. इसलिए कॉर्निया को डिवॉइड ऑफ ब्लड वेसल्स बनाया गया है, जिसके अंदर बिल्कुल भी ब्लड फ्लो नहीं है. उसके साथ साथ उसको बहुत सेंसिटिव बनाया गया है, तो उसमें नंबर ऑफ नर्व एंडिंग्स बहुत ज़्यादा दी गई हैं. अब नंबर ऑफ नर्व एंडिंग्स इसलिए ज़्यादा दी गई हैं क्योंकि जिससे वो बहुत सेंसिटिव रह सके. Anything which will touch the part of the cornea will automatically lead to a kind of a nervous impulse, जिससे हमें ये पता चलेगा कि उसमें कोई obstruction हमारे सामने है. तो कॉर्निया को इसीलिए डिवॉइड ऑफ ब्लड वेसल्स बनाया गया है, जिससे वो ट्रांसपेरेंट रहे, और उसको डिवॉइड ऑफ और एक्सेस नंबर ऑफ उसमें नर्व एंडिंग्स बनाई गई हैं, जिससे उसके अंदर सेंसिटिविटी मैक्सिमम रहे. कॉर्निया के एक और बहुत इंपॉर्टेंट चीज है जो हमें ध्यान में रखनी चाहिए कि इट इज गॉट अ वेरी हाई रिफ्रैक्टिंग पावर, विच इज 2/3 ऑफ द आईज फोकसिंग पावर. जितनी भी फोकसिंग जो होती है कॉर्निया की, it is 2/3, which is quite a lot compared to what the total focusing of the eye is seen. As we go inside from the cornea, the next structure which we come across is the iris. The iris is that structure which gives the color to our eye. आपने देखा होगा कि कई लोगों के अंदर आंखें काली, कई बार हमको नीली आंखें और कई बार ग्रीन कलर की आंखें भी दिखाई देती हैं. This color of the of the eye is because of the iris. This iris is made up of a pigment which is known as melanin, and this melanin is also giving the color to our skin, to our hair, and these structures, the color of the melanin is this light brown in color, which gives the color to our iris also. This iris acts like a guard. जिस तरह हम उसको पहरेदार की तरह समझ लीजिए, जिसमें ये हमारे को आँख के अंदर जितनी रोशनी जानी है, ये हमारी आइरिस ही कंट्रोल करती है. So it is almost similar to the aperture of a camera. Just in the center of the iris is a structure which we call as pupil. This pupil is like it's like a door which is admitting the light inside the eye. कभी आंख के अंदर आप अगर झांक के देखेंगे तो चारों तरफ इस तरह से स्पोक्स, जैसे अपन स्पोक्स ऑफ व्हील्स होते हैं, उस तरह की स्ट्रक्चर दिखाई देता है, विच इज द आइरिस. और उसके बिल्कुल सेंटर में एक छोटा सा छिद्र जैसा दिखाई देगा, विच इज एन ओपनिंग, एंड दिस ओपनिंग इज नोन एज द प्यूपल. द आइरिस इज ऑलवेज guarding the pupil. The amount of light which is entering inside the eye is guarded by the iris. The iris has got small muscles. These are known as sphincter muscles and dilator muscles. जो dilator muscles होती हैं वो उसको iris को widen करती हैं. That is, when the iris is going to contract, the pupil will enlarge, and when it's going to constrict, the pupil will become narrow. Just as we go further, you will find that we have the pupil. The pupil is the structure, and the pupil can be tested by throwing light into the eye. The sphincter muscles which lie around the edge of the iris, it contracts, and this causes the pupil to constrict. And when the dilator muscles, they contract, they lead to the dilatation of the pupil. यहाँ एक बात आप बहुत इसको अप्रिशिएट करना होगा कि जब प्यूपल के जब हम ब्राइट लाइट आंख में डालते हैं तो प्यूपल कंस्ट्रिक्ट करती है. क्यों? क्योंकि द अमाउंट ऑफ लाइट which has to reach to the retina is comparatively very little. ब्राइट लाइट के अंदर प्यूपल constricted state में रहता है क्योंकि the amount of light which has to reach the retina is now less. We don't require this much amount of light. In very bright light, the pupil remains constricted. That means it remains small. But when it's in the dim light, what happens is the pupil remains dilated. Dilated in the sense that now we have to get more light inside the eye. Just behind the iris, we have another structure, the crystalline lens. This lens is suspended with the help of zonular fibers, and it is attached to the structure which is known as the ciliary body. This lens is very flexible. It is controlled, the curvature of this lens is controlled by muscles, the ciliary muscles. The lens is absolutely crystalline and clear, and it is made up of proteins. You have to appreciate that the cornea is transparent. Then the other structure which we come across is the aqueous humor, which is transparent again. Then we come around into the pupil, which is transparent again, and then we come across the lens as we go from outside to inside. So one after the other, the structure which we are coming across, when the light is passing from outside to the inside, they are all transparent structure, and which hence they prevent any kind of obstruction in the formation of the image. Now what happens is that the lens has the ability to focus the whatever it is seeing. When we see the near object or the distant object, the lens has the power of accommodation. What do you understand by accommodation? That it's able to change its curvature according to the need of the time. Like if the object is placed very nearby, you will see that the lens thickens. Why does it thickens? Because it is attached to the muscles, the ciliary muscles, which contract, and they lead to the thickening of the lens. At the same time, what will happen? That when we are seeing a distant object, the ciliary muscles, they relax and the lens thins. But gradually what happens with age, this power of decreasing and increasing of the curvature of the lens decreases, and the person suffers from a disease known as presbyopia, because the lens and the muscles, they gradually lose their ability to contract and lengthen.
This happens in all the individuals?
Yes, it is. Yes, Sonia, it happens, and we find that after the age of 40, usually this kind of this relaxity and this elasticity gradually comes down, and every person has to then change their power of accommodation accordingly. And you will see that older people, they tend to hold the newspaper at a farther distance as compared to a normal person, which is the 25 centimeter we keep as the normal distance from the reading object. So this is always seen in older people. As you gradually grow older, this kind of things comes up.
And they have to go for spectacles
after gradually, gradually. After the age of 40, you have to consult your ophthalmologist and get your reading glasses if required.
Is this can be prevented? Or
no, this is a kind of it's a kind of a nature which nature has given us, and it is comes in early in few people, and it would come slightly late in few people. So it is only that one has to get you have to accept it, that this is a kind of like it's something like graying of hair.
Right.
One has to accept that the hair are going to gray one day. Similarly, these changes are going to come into the eye, and the person has to accept that fact.
Okay, and to what extent this can happen? I mean, can this lead to total blindness also?
Yes, if you know what happens is, Sonia, you will realize that gradually there are suffered few proteins which are present inside the lens, and these proteins they tend to get deposited inside the lens, and this will lead to difficulty in accommodation of the lens. But if gradually, if this is ignored, then the lens may the transparency of the lens may go absolutely, and gradually the lens may become opaque. And once the lens becomes opaque, the only thing we have to do is that we have to remove the lens and put another one, which we usually do, and this is we are going to discuss further when we talk about cataract. But yes, it can lead to, if
Total
not,
blindness
yes, if
also.
it's not taken care of.
And this deposition can be stopped or can be cured or managed?
No, it cannot, the deposition cannot be cured, it cannot be managed also. It is only, the thing is that it is going to come with age, one has to accept this fact.
Okay.
So gradually it is, I told you, it's similar to what
Graying of hair.
graying of hair.
Right.
One has to accept कि हमारे बाल धीरे धीरे सफ़ेद होंगे, तो उसी तरह से हमारा लेंस भी धीरे धीरे एबिलिटी अपनी कम कर देगा, उसका क्रिस्टलाइन स्ट्रक्चर धीरे धीरे ओपेक होता जाता है.
Okay. So this is something new thing we have learnt here today, that after the age of 40, 40 साल के बाद there are chances नहीं, मैडम बोल रही हैं कि almost with everybody this happens after the age of 40, जो लेंस की ability है to focus or to contract or
Yes.
to adjust, it decreases with age. So after the age of 40 there are chances that you have to go for spectacles or something, and this can also lead to total blindness also. जैसे मैंने मैडम से पूछा कि total blindness भी हो सकता है या नहीं, तो she said there are chances that it lead to total blindness, and the term which is given to this is presbyopia. You can note down this term, presbyopia. This is decreased ability of the lens to adjust with age. Can we define it like this?
Yes,
Right?
yes.
Okay, so this is presbyopia. So what do we have next?
Then we, as we go inside now further, when we talk about the lens, the structure which we come across just behind is the vitreous humor. This vitreous humor is a thick and it's a transparent substance, and it fills the center of the eye. It is very viscous, and it is the ability of this, because of this vitreous humor, the eye regains its shape whenever if it is compressed. The part of this eye which it's seen as an eyeball, it's a ball-like structure, is due to the property of the vitreous humor which is present just behind the lens. This vitreous, you will find, is firmly attached to different parts of the retina. So any kind of lesion if you find in the vitreous, this can lead to retinal detachment. Vitreous is adherent, कहीं कहीं पे vitreous retina से बहुत नज़दीकी से जुड़ा हुआ है. तो कई ऐसे कई diseases हैं जिसके अंदर vitreous और retina के अंदर ये जो जोड़ होता है ये निकल जाए, अगर उसके अंदर it is firmly attached, so at places it can be detached, and this will lead to retinal detachment, which we will talk in details as we go further into our topic. Just behind this we have the retina. The retina is a very, very sensitive layer. It is lined with a lot of sensory tissue, and it is the part which is lying right behind in the eye. It's the last lining of the eye. It has got photoreceptors which are in the form of rods and cones, and they are able to convert the light into electrical impulses. जो भी light fall करती है, ये जब retina पे fall करती है, तो ये यहाँ पे एक chemical process होता है. उस chemical process के तहत ये जो उसमें कुछ secretions होते हैं या कुछ chemical reactions होते हैं, उनकी वजह से ये rods and cones they are able to convert them into electrical impulses, and then that reaches to the part of the brain. These impulses, how are they carried now? These impulses would be carried by the optic nerve, और ये nerve इसको लेके जाती है occipital lobe of the brain में, और ये brain का जो part है, ये this is basically involved in the vision, and they are able to turn these electric impulses into images by which we are able to see what is whatever is in front of us. The occipital part of the brain is situated just right behind, and it is on right behind in the head, and it's this part of the brain which is known as the occipital part of the brain. These photoreceptors are of two types. These are the rods and the cones. You will appreciate here that the rods look like rods and the cones, they look like cones. They are very conical in shape. The ones which are conical in shapes are the cones. The rods are at the same time they are rod-like in shape. As we go further, you will find that we have around 125 million rods which are present into the retina, and they are extremely sensitive to light. They help us to see in the dim light. Hence, they are responsible for the scotopic vision. Scotopic vision means the vision which we have in the dim light. Whereas the cones, they are present basically at that part of the retina which is known as the macula, where we have the finest images which is involved. It's the macula. Now this is responsible for the central vision, and they are most densely packed at a point which is known as the fovea. The fovea is the part which is basically responsible for doing very, very fine kind of activities, fine visual activities. For example, we have to needle a thread. So which part of the retina would be taking part? It would be the part which is known as fovea. Similarly, जैसे हम कहते हैं चावल चुनना, या हम जो दालें देखते हैं जिसमें से कंकर और ये सब चीज़ें हमें जो निकालनी होती हैं, तो ये सब चीज़ें जो होती हैं, ये सब पार्ट किसमें सबसे ज़्यादा फोविया ही काम में आता है. यहाँ पे the concentration of the cones is found to be maximum. And what happens is this part works best in bright light, and hence this is known as the photopic vision. Another thing which is very important about the cones is that they are also able to appreciate the color. So cones, as we can remember, C is for color and C is for cones. So cones are basically responsible for the colored vision also. We have three types of cones. Basically, the sensitivity of these cones is for the red light, the blue light and the green light, which you will appreciate. It is very strongly mentioned with the different colors which we have given here. So these three cones are able to appreciate the three colors. The primary colors, these are the red, blue and the green color.
So in color blindness, people who have color blindness,
Yes.
this particular part of retina is affected.
The cones are basically affected, and you will find that these people will be deficient on if they are not sensitive to the red part, you will find that the cones of this red color would be deficient in these cases.
Okay.
And for the ones which are blue color colorblind, they will not have the blue colored cones, or the ones which are green colored accordingly.
So you mentioned only about three colors. What about other colors? How
Yeah,
do
these are
we
known as the
perceive-
primary colors.
Okay.
And in nature, the mixture of these colors leads to the different colors which we see. The galaxy of the colors are basically the mixture of these three colors in different proportions, which helps us in the
So
in
the
the
eye
vision.
does this mixing of colors and all?
The mixing of the color, the nature will give us the stimulus, and it is the stimulus which the eye picks up. और उसी स्टिमुलस की वजह से, मतलब जिस चीज़ में अगर बिल्कुल एब्सोल्युटली रेड होगी उसको हम रेड कलर से अप्रिशिएट करेंगे. पर जिसमें थोड़ा सा आप जैसे मेजेंटा देखेंगे तो उसके अंदर थोड़ा सा रेड कोन्स भी स्टिमुलेट होंगे, उसके साथ साथ थोड़े ब्लू कोन्स भी स्टिमुलेट होंगे, एंड देन वी विल बी अप्रिशिएट अ मिक्सिंग ऑफ दिस टू will together give us the color of this kind. Yes.
Okay. So another important thing we've learnt here is that retina mein there are are these cells, or these are you said
Yes, these are photoreceptor cells.
Okay, these
They
are
are cells.
two types of photoreceptor cells are there, cones and rods, as ma'am said. Cones are important for perception of color. So three types of and these are cells which are responsible for this.
These are
Three
cones.
types of cones are there in our eyes. One is for the perception of red color, one is for blue, and one is for green. And the mixture of these colors leads us to see various other colors, that those are secondary colors. So primary colors can be seen and even other colors can also be seen because of this, but we basically perceive these primary colors, and it's the mixture of other colors, mixture of these three primary colors which lead us to perceive other colors also.
Yes.
Right. So here we have finished with the anatomy of eye. She's just mentioned various parts of eyes. If you could just summarize and
certainly.
for our viewers, and if you could tell the role of each part, like what is the role of cornea, what is the role of iris?
We'll talk about this. Again, we come to the first slide, and you will see over here that the first structure which we come across is the cornea. Now, what we will see in this cornea, it is this is a transparent structure which I already talked to you, and it has got the highest focusing power and a very high refractive index. So this is basically responsible for viewing, and a clear cornea is absolutely important for viewing all the structures. Just behind the cornea, we talked about the aqueous humor. This is a fluid structure. It's liquid in character, and this is continuously being produced by the ciliary muscles over here. These are the ciliary muscles which are producing this, and it is being drained continuously, and this is a continuous process in which we have this transparent liquid which is known as the aqueous humor, which comes in the path of light. After the cornea, the next comes the aqueous humor. After the aqueous, we have the pupil, which is a very clear area which is guarded by iris on the two sides, which are acting like guards, and they are only allowing the amount of light being guarded by the iris. Just as we go behind after the pupil, we have another structure which is known as the lens, and here at the lens you will see that this is absolutely crystalline, transparent, it is another great focusing power, and they are able to focus the object right behind at this point in the retina, which is known as the macula, right? So, and these as soon as the images reaches the macula, from macula there are reactions which take place, and these photosensitive rods and cones are stimulated. The chemical reaction here takes place. These chemical impulses then reach into the optic nerve. From this optic nerve, these are taken through the nerve cells, and these chemical messages are converted into electrical messages, and they reach into the brain, which is the occipital part of the brain, which I already pointed out as the brain part which is just behind, and there we see these images in the form which are present in front of us.
And which part of the eye, I mean, you've told so many parts in that, so which part of the eye should be affected in order to say that person has visual impairment or visual disability?
Yes, what I want to specify here, that I have only talked about those structures which would lead to visual impairment.
Okay.
There are other structures in the eye which we have not talked. There is like as we talk about the eye, there is another layer which is known as sclera, which is the outermost layer. And just behind the sclera, we have another layer which is known as the choroid, which is, and just inside the choroid, it is the other layer is the retina. So you will see that the eye is almost like an onion, जिसे हम प्याज बोलते हैं. जिस तरह से प्याज के ऊपर एक परत चढ़ी होती है, उसी तरह आई के ऊपर भी एक के बाद एक परत चढ़ी हुई है. जो सबसे पहली परत है उसको हम स्क्लेरा बोलते हैं, और उसके नीचे एक और परत है जिसको हम कोरोइड बोलते हैं, और उसके नीचे एक और परत है जिसको हम रेटाइना बोलते हैं. तो हमने वही स्ट्रक्चर्स डिस्कस करे हैं जो हमारे को विजन के अंदर हेल्प कर रहे हैं. The rest of the structures are also present over there, but which are not directly involved in the vision.
Okay.
And they are only acting as a protective layer, or they are acting as a nourishing layer to the eye. And basically sclera is a protective layer, the choroid is a nourishing layer, and the retina is the layer of vision.
Okay.
So these are the layers, or these are the structures which we have talked in the eye, which are basically involved.
So even if the eye is absolutely normal and the problem is in optic nerve or at the level of occipital lobe,
Yes.
then also a person
Yes,
would have
yes,
visual.
certainly, because that already I have told you that जैसे हमने आपको बताया कि हमने जब अपनी इस पहली आपको स्लाइड में पहले बताया कि these structures one by one will lead to the cornea, the aqueous humor, the pupil, the lens, the vitreous humor, the retina, optic nerve and occipital part of the brain. Any involvement or any kind of a disease to any of these three, or sorry, all these which I have mentioned would lead to a defective vision or visual impairment.
Okay. So here we finished with the anatomy of eye. Madam ने बताया there are various parts of eyes. We've already discussed the function of each part, and as she has mentioned, any problem in any of these parts which she has mentioned already, any problem in these parts can lead to problem in vision. It can lead to visual impairment or vision disability. We have come to the end of anatomy. Now we are going to talk about some of the tests of eye. If you have any doubt regarding anatomy of eye, you can call us at 265111611 or 265111613. You can also fax us at 265111609. So this was about anatomy. Now let's go to some of the tests which we use to assess eye.
Yes, this is आपने हरदम जब भी अपन आँख के बारे में बात करते हैं तो कुछ टेस्ट होते हैं जो हम लोगों को कैरी आउट करने पड़ते हैं टू असेस दैट व्हाट इज द स्टेटस और व्हाट इज द अमाउंट ऑफ विजन विच इज प्रेजेंट इन अ पर्सन. इनको करने के लिए हम कुछ टेस्ट्स हैं जिनको हम विजुअल एक्विटी, विजुअल फील्ड और कलर विजन के नाम से जानते हैं. और एक और टेस्ट है जिसको हम टोनोमेट्री कहते हैं. वो टोनोमेट्री इज वो टेस्ट बहुत इंपॉर्टेंट है इन केसेस ऑफ डायग्नोसिंग द केसेस ऑफ ग्लोकोमा. आई विल ये मैं आपको एक एक करके आपके सामने आपको डिस्कस करती हूँ एंड आई होप आई विल बी एबल टू क्लियर दिस. विजुअल एक्विटी, ये जो चार्ट आप सामने देख रहे हैं, दिस इज अ चार्ट विच यू मस्ट हैव सीन ऑलमोस्ट एवरीवेयर. आप जब भी अपना विजन चेक कराने जाते हैं कोई भी ऑप्थेल्मोलॉजिस्ट के पास या कहीं पे भी, तो ये चार्ट आपको सामने दिखाई टंगा हुआ दिखता है एंड दिस इज नोन एज द स्नेलन्स चार्ट. दिस इज यूज्ड फॉर स्क्रीनिंग, मास स्क्रीनिंग ऑफ द पेशेंट. अगर हम लोगों को विजन में कोई भी प्रॉब्लम है, दिखाई देता है नहीं दिखता है, ये चार्ट हम मास स्क्रीनिंग के लिए यूज में लाते हैं और इसको हम विजुअल एक्विटी के नाम से जानते हैं. नाउ व्हाट, इसमें हम क्या करते हैं कि जो व्यक्ति है उसको हम एक टेस्टिंग डिस्टेंस पे खड़ा करते हैं एंड दिस टेस्टिंग डिस्टेंस इज at 6 meters from the chart. इस चार्ट के आप नीचे अगर इसको स्ट्रक्चर को देखेंगे, इनमें जो अल्फाबेट्स लिखे हैं उसके छोटे छोटे उसके नीचे आपको कुछ नंबर्स दिखाई देंगे विच इज 36, 24, 18, 12, 9, 6. ये क्या होता है कि these are the letters which are read by the viewers and they subtend an angle of 5 minutes of an arc. दैट इज सर्कल के अंदर 5 मिनट्स का जो आर्क होता है उसका जो एक, दिस इज बेसिकली मैथमेटिक्स विच वी शुड नॉट गो इनटू द डिटेल्स ऑफ इट, बट विजुअल एक्विटी हमको मेजर करने के लिए 6 मीटर की डिस्टेंस पे पेशेंट को खड़ा करना पड़ेगा और ये जो भी लाइन ये पढ़ पाते हैं वो लाइन हम नीचे मेंशन करते हैं. सपोज अगर पेशेंट पढ़ पाता है HZP, then the vision becomes 6/18. If the person is basically able to read UPNTUHX, then the vision becomes 6/6. That is, you are able to read the last.
How did you say 6/18? I didn't get.
Okay, we come back to this and I'll show you. Can you appreciate there are some numbers which are given right behind?
Yes.
Right. So the person is standing. The testing distance is 6 for everybody.
6 meters.
6 meters.
Right.
And at the same time, if you're able to read this line, then your vision becomes UAZNFDT. So your vision automatically becomes 6/6.
Okay.
And that's the perfect vision. The normal vision is 6/6. So this is how we do visual acuity. When we come to the next slide, we will see that this is the one which we do the field of vision. अब फील्ड ऑफ विजन में आपको मैं बहुत स्पेसिफिकली बताना चाहूँगी कि हमारे पास दो तरह के विजन होते हैं। एक तो होता है कि हम जिसे कहते हैं द सेंट्रल पार्ट विच इज़ द सेंट्रल विजन। एट द सेम टाइम आप ये नोटिस करेंगे कि आप जब सामने देख रहे होते हैं तो आपको कुछ अमाउंट अपना साइड का भी दिखाई देता है विच इज़ द पार्ट ऑफ द टेम्पोरल विजन। तो वो टेम्पोरल विजन बोल लीजिए या उसको द बेसिक टर्म शुड बी द पेरिफेरल विजन। तो जब हम बैठ के देखते हैं तो हम जब सामने देख रहे होते हैं तब भी हमारे को हमारे पास में कौन बैठा हुआ है, that also we come to know because of the peripheral vision which is present within the eye. So we have two type of vision, the central part and the peripheral part. Here you should appreciate in the slide that if the person, normally the person should be able to see the whole vision like this. This is the total vision area. But if there is any kind of disease in the eye, the peripheral vision, if it is affected, you will find that the person who's appreciating is only appreciating the central part and the peripheral part is gone. Here you will see that there is a person who's doing the perimetry. This vision field is measured by an instrument which is known as the perimeter, and we do this, it is called as the perimetry. The next part of the vision which we see, which we talk about, is the colored vision, which अभी हमने इसको डिस्कस भी करा था आप लोगों के साथ. तो this is done by the Ishihara plate. Here you will appreciate that color blindness is not a kind of a blindness, it's a misnomer which we called as a blindness. Color blindness is a kind of, it is a person has a normal vision, so we cannot put the person into a category of blindness. Here you will see that the person only has difficulty in distinguishing the colors like red, green, yellow or blue. Here you would appreciate in this that there is the part of a rose. The half of the rose is red and the half is slightly in a darker color. So the person who is suffering from a color blindness will appreciate the rose which is on the other side, the one which has got a vision normal, which appreciate the rose as bright red in color. Similarly, you will appreciate that there is another slide which shows number 56. And this number 56 will only be appreciated with those people who do not suffer from color blindness. So what we find mostly that people are deficient in red color, and red color deficiency is the commonest of all. The least common is the blue and the yellow color deficiency. And here I hope you will be able to appreciate the basic color, the red, green and blue. When they mix with each other, how do they make up? There is a play of colors which is seen. जिस तरह से मैंने अभी आप लोगों से अपने डिस्कस भी किया और ये बात भी करी कि ये सब कलर एक दूसरे से मिलकर, ये रेड के साथ ग्रीन मिलकर येलो बना रहे हैं, उसके साथ रेड के साथ ब्लू मिलकर हमारे पास एक और कलर बन रहा है, एक मेजेंटा कलर रेड और ब्लू के साथ मिल रहा है, और ये जब इक्वल प्रोपोर्शन में तीनों कलर्स द रेड, ग्रीन एंड ब्लू दे मेक अप वाइट. So this is one thing which we have to appreciate, that the color blindness is not a kind of a blindness, it's only that the person is unable to appreciate the color, and the commonest of it is red and the least common is the blue and the yellow.
So only these three types of tests we do with any person with visual impairment. We check the acuity, we check the field,
yes,
and we check the color.
Yes,
vision.
and another one is the tonometry, by which we check the pressure of the eye. This tonometry is done by a tonometer, and we put the tonometer onto the cornea, and it gives the measurement of the amount of pressure which is present inside the eye, which we will discuss further as we come to the specific disease which is known as glaucoma, in which the intraocular pressure is markedly raised.
So all the 4 tests should be done in all the patients, or there is some specific test for a specific type of impairment?
No, like when we go to a doctor for a clinic or a ophthalmologist, these tests are required for testing for visual impairment, and usually all these 4 tests should be done. But as far as we have talked, for mass screening, we can do a visual acuity test, because it's very difficult, it's laborious at the same time, that we have to carry out all these tests to assess a person. So for a mass screening or mass assessment, it is we can go by the visual acuity test. And if we have to but if we have to do a specific, and once we are able to detect a person of visual impairment among that mass screening, when we do the mass screening, it will be appreciated that that person can be taken into this specific test for color vision and visual acuity, peripheral perimetry and tonometry.
The visual acuity test, the diagram you had shown, that is the chart, Snell's chart.
Yes.
It's in English, so people who do not, appreciate English alphabets, for
Yes,
them, do
yes,
we have
yes,
some
yes.
other tests?
Yes, we have that, and you must have seen that we have there are rings which are pointing out. इसको सी के शेप में रिंग्स होती हैं, और उनको हम पेशेंट को हम बोलते हैं कि आप इसका मुंह किस तरफ खुला हुआ है ये बताइए.
Okay.
और कुछ पेशेंट्स के लिए ई के भी होते हैं, ई स्ट्रक्चर होते हैं, जिसमें हम ये कहते हैं उनको कि भाई 3 उंगलियां जैसे दिखाई दे रही हैं आपको, वो किस तरफ पॉइंट आउट कर रही हैं. तो वो हम उन लोगों के लिए करते हैं जो लेटर्स को अप्रिशिएट नहीं कर पाते हैं, मतलब अंग्रेजी लेटर्स नहीं अप्रिशिएट कर पाते हैं. और हिंदी के अंदर भी इशारा चार्ट आता है, इंग्लिश में भी आता है. एंड दोज पीपल हु आर नॉट एबल टू अंडरस्टैंड इंग्लिश और हिंदी, we have, or maybe it can be, our country is a multilingual country. For then in all these cases we have structured E which are facing different positions, and then we ask them कि इनका कहाँ पे इनकी मतलब किधर ये आपको खुलता हुआ दिखाई देता है, इसको appreciate करके, और they are able to read it.
Okay, so we ask the direction of the E.
Yes, direction
and
of the E.
Again, the size of E changes accordingly.
Yes, accordingly. The all are in E, and the direction are they are either the E is pointing upwards, or it might be pointing downwards, or it might be pointing sideways.
Okay, and these charts can be used for children also of any
Yes,
age?
yes. These charts are used for everybody, and these are for visual acuity. These are the charts which we use for. And it is, as you have told you, it's 6 by, the meter has to be, this distance is the primary factor which you have to be very careful. At the same time, another thing which I want to emphasize, that it is done by one eye at a time.
Okay.
Which I have to mention. It is done with one eye, and we always take the readings for left eye and right eye separately.
Okay.
And the person has to cover one of the eyes and then read with the letters first, and with the either left eye or right eye, doesn't make any difference. You can read it with the right eye and the left eye, one after the other, and it has to be done for the 2 eyes in a differently.
Okay, so how reliable is this? Is it a good test? Good, I mean the reliability is good?
Yes.
Okay.
So
it's
a very reliable test, and that's best test which we can do for the mass screening of the patients.
Okay, in the visual field, I have one doubt that you said there are 2 types of vision, one is central and one is peripheral, and you gave an example where peripheral vision is affected. Where do we have cases where central vision is affected, whereas peripheral is normal?
You know, I would you would see, in case, now when we are talking about, when we talked about the path of the light, right?
Yes.
It has passed from the cornea to the aqueous humor to the pupil, and from the pupil it has gone to the lens, and from the lens it is reaching the retina.
Right.
In this path, if you find that there is any kind of lesion on the cornea in the central part,
okay,
cornea
the
central vision will be affected.
Okay, so it depends on the cornea where the lesion is basically. If it is at the central level, then central vision will be
if
affected.
it is maybe the central part of the, if the central part of the lens is affected,
okay,
the vision of the central part will be gone.
Okay.
Similarly, if any part, the aqueous humor, if we have any kind of, it is known as any kind of infection in that area, then what will happen is that the path of the light which is traversing, the central part will be gone.
Okay.
So one has to be very clear when we of the structure of the eye which we are going through. If the central part is affected, central part of the cornea will be affected, the central vision will be gone. If the peripheral part of the cornea will be affected, the peripheral vision will be affected. Similarly, it happens in other diseases which I will enumerate one after the other, how the vision is affected.
So you got it that we have 3 tests she's mentioned. 3 tests के बारे में बताया मैडम ने. One is visual acuity test, second is visual field test, and third is color vision test. She's talked about the other test also, and 4th test, that was
tonometry,
and she'll discuss that in detail later. Now let's come to what is visual impairment. Coming to the definition of visual impairment, let's see what is visual impairment now.
Now, as we define visual impairment, it is any kind of vision loss. It cannot, a person can have a total loss of vision, or it could be a partial loss of vision. The two category where there is total loss as well as partial loss are labeled as cases of visual impairment. तो this part should be very clear. या तो व्यक्ति को बिल्कुल ना दिखाई दे, वो भी कहलाएगा visually impaired, या उसका पार्शियल बहुत कम विजन हो, पार्शियल विजन हो, तब भी हमको उसके कैटेगरी ऑफ विजुअल इम्पेयरमेंट में डालना होगा. जहाँ पे भी विजन की जो पूरा विजन अगर व्यक्ति को नहीं दिखाई देता तो वो व्यक्ति विजुअल इम्पेयरमेंट का ही केस कहलाता है.
Even it's a mild vision loss, like
Yes.
anybody who has spectacle has visual impairment, we can say.
Yes, but you know, अगर जो स्पेक्टिकल पहन रहा है उसके बाद हमने उसको करेक्शन दे दिया है,
Right.
now his vision has become normal
After wearing the spectacle.
after wearing the
Okay.
spectacles. Till the person is not wearing a spectacle, the person is visually impaired.
Okay.
Once you give a corrective measure to the person will come into the category of a normal vision.
Okay.
Then the person will have a vision of 6 by 6.
Right.
If a person has got a vision of 6 by 18, and if you give a corrective measure, a lens, and the person is able to see and has a vision of 6 by 6, then the person comes automatically into a case
normal.
of normal vision.
Okay.
So after giving correction, the person will not be labeled as a case of
Right.
visually
If you're
impaired.
not wearing a spectacle,
Yes,
and
then certainly.
even if it is mild
Yes, yes,
problem, then
yes.
it comes in a category of visual,
Visual
impairment.
impairment.
And how it is different from visual disability?
Because you know the two terms are the person who is visually impaired will be visually disabled also.
Okay. Any person who is visually
Yes.
impaired is also visually
Comes into the
disabled.
category of disability.
Disability. Okay.
Disability, you know what is impairment is basically it's in a kind of, if we see the physical part of a person is the disability.
Right.
The medical part of the term is the impairment. A
Okay.
person who is going to have visual impairment will have the disability, and the disability is will be according to the percentage of impairment.
Impairment. Right.
And we have this, we will not go into the details of it because this comes under a different topic altogether, where we assess the person and we make him 80% or 20% or 30% depending upon the amount of vision or the visual field or peripheral field, and whatever the part of vision which is present with the person.
Okay. So mainly the physical part of it is.
Yeah, the
it comes to
disability is the
disability.
physical part of a visual impairment.
Right. What do we have next?
Now, what you will realize, you will see that visual impairment, it can be either congenital. Congenital is that it is present at birth, or it could be acquired. Acquired means that the person gets this disease during lifetime, and here the age is not the criteria. Congenital are those cases which are their children who will be born visually impaired even at birth. This is very common as we see in congenital cataract, which is seen in infections due to cytomegalovirus virus, rubella, herpes, and these are the cases who are born with cataract or the lens opacity. The congenital cataract is common among children whose mother, or common among fetus basically. I should not be calling it children because the child is still in the womb. So it becomes a fetus. So what happens is this, the mothers who acquire rubella infection would have the fetus infected because of the rubella virus, which is commonly also known as German measles. Now this infection passes from the mother to the unborn child, leading to mild fever and rash in the females, and the child would be infected and would suffer from growth retardation, malformation of the eye, deafness, liver and spleen problem, and also will have cataract. These, now what is very, I want to specify that this disease is a kind of a disease which can be controlled, which the society can make an effort, and this disease can be prevented and how this can be prevented? It is by giving the mother's injection of or vaccines, which is known as MMR, measles, mumps and rubella, and these vaccines are given to the children between the age of 12 to 15 months. The second dose can be repeated at the age of 4 and 6 years. By chance it happens that this vaccine has not been given to the mothers, then it is very essential that all females may be vaccinated by giving this vaccine between the age of 12 to 14 years to the females, which would give them a lifetime immunity against this disease of rubella, and we can have healthy babies, babies who are not suffering from visual impairment to the mothers. And this, what is the primary criteria is that the mothers or the girls or the female child have to be vaccinated against the rubella. One precaution which has to be mentioned, and I would like to specify here, that the patients who are given, or the people or the ladies or the girls who are given this vaccine, it should never be given to pregnant mothers, because if you give this vaccine to the pregnant mothers, you're introducing this rubella into the females. So it has never to be given to a pregnant mother. And at the same time, if it is given to a girl of a childbearing age, she should be instructed not to have a pregnancy at least for 3 months after the vaccinations have been given, because here you have these live vaccines within the live rubella vaccine or virus has gone inside, and this might lead to any kind of malformation in the child or in the fetus, as we have already discussed. So the congenital part, I just want to emphasize here that rubella is one disease which can be prevented, and can be prevented by a simple vaccination of childbearing females, and these females in the childbearing age can be prevented by just giving a simple vaccine, which is known as the MMR vaccine, commonly known.
So this is a message actually to all the females.
Yes.
At the age of puberty, at least 12 to 14 years,
Yes.
they should take
Yes.
this vaccine so that they can get healthy children.
Yes,
later
healthy
on.
children, at least these children who are not visually impaired, we can, this is something, it is something exactly like polio,
Right.
where we are giving this polio vaccines to the children, and we are giving a society which is a disability free society.
Right.
Similarly, rubella is another disability which can be prevented among the children by giving a vaccine which is known as the MMR vaccine.
Okay, so and you mentioned about this can be given to children also at the age of, you said 12 to 15 months.
Yes.
So these are all the children, or only to children who have this problem?
It can be given, it is to be given to all the children.
It is to be given to all
Yes.
the children. So another important message for all the ladies, once they reach puberty, they should take this MMR vaccine so that they can get healthy babies later on, and they should be prevented from German measles, which is one important cause for visual disability. And as she mentioned, there can be other disabilities also associated with this. It can be deafness and other problems also.
Yes.
So you can prevent yourself and your babies, you can prevent your babies from getting such type of disabilities by just taking one particular vaccine, that is MMR. So very important message. And to all the children at the age of, as she said, 12 to 15 months, this particular vaccine should be given to all the children, so that later on they can be they should not get this problem of German measles.
I just want to emphasize that why I'm because there should not be any confusion regarding it, because we are giving it to the children at the age of 12 to 15 months, and why should this be repeated?
Right.
You know what is happening is that though this comes into our vaccination schedule, which we say that this has to be given between 12 to 15 months. This 12 to 15 months, when we give MMR, we are also preventing the child against a very deadly a disease which leads to a lot of mortality and morbidity, that is measles.
Okay.
So when we give it to the younger child between the age of 12 to 15, we are preventing measles, mumps as well as rubella. Measles is one of the diseases which is leading to a lot of disability or debilitation, or a kind of the children may suffer a lot due to this, and there could be infant mortality also.
Okay.
So when we give it to a younger group between 12 to 15 months, we are preventing the child from developing measles, mumps and rubella.
Right.
They are the another three diseases where measles has got the highest infant mortality, due to which infant mortality can be very high. So if it is given to the younger group, we are saving the child from three diseases. But in case suppose we don't give it to that, and if the child does not get MMR at that time, if we give it to the girls at the age of 12 to 14, we are bringing up a healthy child into a healthy fetus or a healthy baby into the society, who would be at a least risk of rubella.
Rubella, okay. So it should be given to both mothers as well as to children.
Yes.
Right.
And
And as she said, it should be given at the age of 12 to 15 months, basically to prevent three problems, that is mumps, measles and rubella. And in case you're not able to give at that time, at least mothers should be taking this particular vaccine at the age of 12 to 14 years of age, so that they can give birth to healthy babies, right?
yes.
Okay. So this was about congenital problem, congenital cause of visual impairment. Let's see what is the acquired cause now.
Yes, the acquired causes can be due to infections. It can be due to injury or trauma to the eye. There can be abnormal blood vessel growth, which is seen in the eyes, as in cases of premature birth or in diabetes. There could be a macular degeneration, where the macula, as we talked about, the retina, the most sensitive part of the retina, where there could be degeneration, and this could be an acquired cause of leading to visual impairment. There could be genetic conditions like retinitis pigmentosa, which is very common in and it's heard by everybody. So these are the acquired causes which can be seen later in the person's life as later.
So infections, all these can be cured, right? Infections and as you said,
Yes,
there
yes,
can be
but
injury or
yes, but
trauma.
if as we will talk about, I'll talk about as we go further into the details of it. There are few infections which will, once it comes, and it can lead to corneal opacity or scarring of the cornea. So if these infections are not cured properly, then the scarring will further lead to the visual impairment.
Okay. So here we talked about the congenital and acquired causes of visual impairment. Let's see what next we have.
Here we talk about the global estimate of visual impairment, which is given by WHO, and you will find that Southeast Asia is having the highest number of cases of visual impairment, which comes to around 27%.
What could be the reason of why Southeast Asia has?
Yes, these are malnutrition, poverty, lack of education, and we have few practices of putting surma, kajal.
Right.
This is another very important thing which leads to the contamination of the eye, and leads to also transmission of disease from one person to another.
Okay, there's something very common we practice in India. So
yes.
You suggest that this should not be done. The kajal and surma, you should not be putting.
Yeah, the kajal surma practice does spread infection from one person to another.
Okay.
When we are, and surma, especially the sticks which we use, can be used by two, 3 different persons. So anybody suffering from any kind of infection can further transmit it to the next person.
Okay, and this carbon what we use, a kajal and surma, can
Yes.
also lead to
Yes,
some problem?
yes, it can. It causes there is a small puncta which is just below the lid. If you have ever noticed, the lower lid and the upper lid, these are called as punctas, and here the punctas can get the soot can block this puncta, and this is another disease which of course doesn't lead to visual impairment, but we have a disease where there is excessive watering from the eye. This excessive watering is due to it is known as the lower puncta and the upper puncta, which is on the lid, which gets blocked due to the soot, and this soot this leads to the drainage of the lacrimal glands which is present is blocked, leading to continuous watering from the eyes.
Okay. So this is another important message what she wants to pass. Don't put surma or kajal in your eyes and eyes of your children. And you can also pass this message to others that this can lead to problems of eye, not necessarily visual impairment, but there can be infections and other problems of eyes which can be there.
Yes.
So this is another important message. And
when we talk about Southeast Asia, I want to emphasize here that in India itself, we have there are 22 million people who are suffering from different kind of disabilities, and out of which half are visually disabled, which is followed by the orthopedic, and the next is the deafness, the two disabilities. 2% of the Indian population is suffering from disability. This is what the real amount, the number which comes to, and it is found that 3 out of 5 children, if 5 children are suffering from disability, it is found that 3 of those children would be suffering from visual disability, which we feel is very, very high. And hence, it is very important that we have to be aware, we have to stop it, and we have to take measures so that we can prevent visual impairment among our population.
What can be the reason why visual disability is more found in India, and I mean compared to other disabilities, as you said?
Because that is what it's the thing is that eye is a very susceptible organ, and another thing is that it is a very, very sensitive organ at the same time.
Right.
As far as we talk about physical disability, there are other things which can take up. For example, we have the arms and the other part. But what I feel that eye is being very sensitive organ, and it is almost the outermost organ, which is a very exposed organ compared to ear. Which is very internally situated, and eye is the organ which comes right in front, or it is the first organ which a person whenever you come in contact with the environment, the eye is one organ which is just coming directly in touch. So that is the reason why, and the eye is more susceptible. It is a very sensitive organ at the same time, and most of the action which is taking place, or the formation of vision, is very, very electrical, and it is all impulse based. So it is any kind of problem in this part, the electric impulses which are being carried can lead to the vision. So visual disability is comparatively higher compared to the rest.
You just now mentioned about the acquired and congenital causes.
Yes.
During the prenatal period, any physical if the mother is not well, she has hypertension, or such causes, such problems can also lead to visual impairment?
Yes, it can, but usually visual impairment is not seen with hypertensive mothers, but yes, diabetic mothers do suffer from any kind of, but usually not. Usually infections like herpes, cytomegalovirus, rubella are the common causes which lead to vision problems in the child or the fetus, which is passes
so
on.
it's basically viral or bacterial infection.
Yes, usually hypertensive and diabetic mothers do have children with visual disability. Okay. There are chances.
So even mothers who are diabetic can have children with visual impairment, and as she said, more of if mother has viral or bacterial infection during pregnancy, it can lead to visual impairment. As example, she gives cytomegalovirus. There can be herpes or cytomegalovirus, such kind of viral infections can be there to the mother, then a child can lead to visual impairment. So now what do we have next?
We go ahead and we find that there is another estimate which I have with me, which is again given by the WHO, and here you will find that as we go further, that the maximum cases of visual impairment fall into the category of it is present due to cataract, where we have 12.3 with glaucoma, and 8.7 is age related macular degeneration. Diabetic retinopathy forms 4.8%, childhood blindness, which we talk about as congenital part, which is around 3.9, and trachoma is another disease which I will discuss with you, which is causing 3.6% of visual disability or impairment in the person. So you will find that cataract is taking a major portion, which is almost 47.8, and another, this is one disease which is again can be easily cured. As we go ahead, these are the refractive errors which can lead to a kind of visual impairment later in life, and the first and the foremost which we come across is the myopia. Myopia is also known as nearsightedness. Usually here what we will see that it is seen among children between the age of 18 to 12 years. A very easy way of remembering that why do children suffer from myopia is that they cannot see further. they are very nearsighted. So that's how we have always remembered that children, they cannot foresee things. They can only see things which are just right in front of them. So the children are usually, they suffer from diseases of nearsightedness. This is a basic way of just remembering that myopia is nearsightedness. And here what happens is that the eye is longer than normal, and due to which what happens is that the vision, whatever the image is formed, it is formed right in front of the retina instead of forming at the point in the retina. It's formed in the front of retina here. And what will happen is that gradually what happens that severely myopic people or children will have risk of detached retina. They are able to here the children will be able to see close objects, but distant objects look very blurred. So children will be able to see things at a of closer distance. You must have seen that children who suffer from myopia, they tend to see or read or place their books very much near to them while reading, or they will watch television at a very close distance. So these children, it has to be emphasized, and I want to emphasize over here that these children should be at least they should get their visual acuity done.
You just now mentioned that eye is longer, so shape and size of the eye affects the visual acuity.
Yes, it does.
It does.
It does.
Okay.
Because in here it is found that there are the shape is of course different.
Okay.
The size basically, the length.
Even if you see normal people, some of them have big eyes, some have small eyes, some have long eyes. There are different types of eyes. So does this have something to do with the vision?
No, what we are seeing from outside is not related. It is due to the length of the eyeball, basically, and it is not related to the eye which we see from outside.
Okay, so it's not
no.
So it is the eye ball you're talking about.
It is the ball, the total ball with the length of the eyeball, basically, which is present inside.
And this reason you've told is congenital, but there are people who get acquired myopia. What could be the reason for that?
This could be usually what happens is that they do suffer. They might be having this, the length will be less, but they have the power of accommodation is higher.
Okay.
So they are able to adjust, and gradually over the years they lose, and it could be even due to the ciliary muscles, which they may be slackened in some cases where they are not able to adjust accordingly.
Okay. So most of the times it is congenital, the problem of myopia.
Myopia, it can come up later in life also.
Okay, because
not
of the ciliary muscles.
Yes, gradually.
So we've learnt one problem, that is myopia, as she said, nearsightedness. And how you can remember this is, it is mostly seen in children, that children tend to see closer objects more properly than the far objects. So nearsightedness means you can see the nearby objects clearly and you cannot see the distant objects. So that is myopia, and she said it can be because of the size, that is long, the eyes are normal, that is, she is talking about the eyeball, not the actual eye what we see from outside. It is the eyeball is longer than the normal, that can lead to myopia, which is a congenital problem. It can be acquired because of the ciliary muscles, problem in the ciliary muscles. It can be acquired later also in life. So what is the next problem we have?
Yes, we talk about hypermetropia. It's also known as hypermetropia or hyperopia. This is known as farsightedness, seen in elderly people. And here you will see that as part of the philosophy goes, that older people, or as you age, you are able to foresee things. So then you become farsighted. So how do we remember is that hyperopia is farsightedness. Here you will see that the light or the images which are focusing, they are focusing behind the retina. And when they focus behind the retina, the eyeball is shorter in hyperopic patients, and they have the words on a page will appear blurry, and they will find it difficult to thread a needle, and at the same time, if this is also left untreated, it can lead to fatigue and headache, but in a very long cases where they are not treated at all, may kind of lead to visual impairment. The next when we
they are
yes.
able to see the far things more clearly compared
Yes,
to the
yes.
near things.
This
is
happens to the older people, where like how we used to remember is that older people are able to foresee things, so they are
Okay.
far-sighted. Myopic are the children are myopic because they can only see what is right ahead of them. They
Okay.
cannot foresee things.
Right. And now if such children, say for example a child has myopia and the person keeps his book very nearby, then
Yes.
is it a normal thing? You know, there are mothers who keep saying their children, don't keep your book
Yes,
at such close
we
by.
have to have an optimal distance, which we have already talked, that it should be at a 20 to 25 centimeters, and where the reading material should be kept in front. And if the children are able to read from that distance, it's perfectly fine. But if you find that the child is putting is taking the books very nearby or reading material very nearby, then in that case, it is essential that they should get their visual acuity checked.
Okay. And I mean, if a person has myopia and they're doing this, that again is a wrong phenomena. We should go for
Yes,
the
a vision test
visual
for
test.
yes, visual test for these children.
And they shouldn't be adjusting within their own
Yes,
vision.
yes, certainly never.
And it will lead to fatigue or
Eye,
it can
yes,
lead to
eye
other
fatigue,
problems.
headaches, blurring of vision
Okay.
gradually.
So we've learned two problems. That is, one is myopia and the other one is hyperopia. Myopia, as she said, seen more in children. They can see the nearby object more clearly compared to the far object, distant objects. And the other problem is hyperopia, which is seen more in older people, geriatrics, and in this you can see the distant objects more clearly compared to the nearby objects. And a person has, if anybody has such type of problem, they should go for a visual acuity test. This is something very important. And what is the next problem?
Next we talk about is astigmatism. Here we see that both the far and the near objects may appear blurry, and it occurs in combination with myopia and hyperopia. I want you all to appreciate at the same time that there is a page written, and a blurry vision, a person who suffers from blurry vision would see something like this, what is seen up on written on the paper. And this is how the person can be diagnosed, or you can appreciate, or the person can appreciate that the vision is not normal, where the vision is becoming blurry. And this is basically due to the cylindrical curvature of the cornea, which prevents the light to focus at one point of the retina, but it is focused at different areas. You will see that there are at least two focal points here, which can be seen as first and second. And this is another cause of blurred vision or astigmatism. Here you see the first point, and there here this is another point, and this is the second point. And this is due to the cylindrical curvature of the cornea. I should mention here that these can be of course treatable. For myopia, we usually give a concave lens to the child. For hypermetropia or hyperopia, we give a convex lens to the patient, and we are able to treat it. For astigmatism, we can give a cylindrical lens to the patient, and we can again treat the cases of astigmatism. The next we talk about is another disease which is known as presbyopia. Presbyopia is a condition, it is seen in elderlies, and here it is a normal part of aging, and you will see that after age of 40 the lens becomes rigid and cannot change shape as easily. The eye it's difficult for the eye to focus objects clearly, and you will see that patients who suffer from presbyopia tend to hold objects away from their body or away from their eye. This is due to the muscles, they become lax, and the lens becomes thickened due to deposits of protein and other calcium and other kind of structures which are present inside the lens. If it is untreated, this will also lead to eye fatigue and headaches. This can be treated again by giving patients bifocal lens, which enables them to see far and near and far objects together with the help of bifocal lenses. Another the latest these days we talk about, which I want to mention here, is keratoplasty, keratomy, and they say that laser is another thing which is known as LASIK, LASIK, which is it is known as lesser in situ keratomyeliosis, where they are able to thin the cornea, and because of the thinning of the cornea, they are able to make the vision possible, and they claim that they are going to remove the lenses. So the lenses are the glasses, eyeglasses can be thrown, and you can have a perfect normal vision. And what they usually do is that they do the thinning of the cornea, and because of that, the refractive index or the refractive power of the cornea is either increased, due to which you are able to get rid of the glasses.
But how successful it is, the deposition can occur again.
No, because look here, since most of the refraction in the eye is done by the cornea. I already said that 2/3 part of refraction is done by the cornea. So if we kind of give the refractive power of the cornea is increased, so the patient will be able to see, and hence it will become easier. So, but of course the age related of course changes which are taking place, you cannot by any chance redo them or undo them. But the ones which are in the cornea, the refractive error, especially the myopia part can be treated by doing laser surgery, which is known as LASIK, where you can throw away the lenses can go away, and the refractive power of the cornea can be increased.
But then how, I mean, will it not increase after that?
No, it would change.
And
again.
then again
Yes,
you have to go for
yes,
surgery
yes, you
after
have to, yes,
particular
but usually
period.
not required, because for some period of time this is going to be, it's going to last, so they really work out well.
How many years? I mean, do we have any specification, like if
Not
a person
exactly.
does?
No.
Not exactly. Okay.
Not exactly. The next thing when we talk about is another disease which we know as albinism. This this disease is, which is commonly seen, is here you have that the patient have decreased amount of melanin in there, and the skin is also the pigment which we already talked about. This pigment is present in the iris. This when there is this pigment is less, the amount of light which enters into the eye is more compared to in a normal person. Hence, the person will have difficulty in visual acuity, and the sensitivity of light is also comparatively, they are very sensitive to light. This can be treated, and they also have nystagmus. This nystagmus is involuntary eye movement, which I am sure you all must have appreciated, and usually they have very thin iris, and due to which you get that it has a feeling that the eye is red colored or very light colored eye. This can be easily be treated by giving lenses to the person, and it can be also glasses for vision, and colored lenses are of great help in the cases of albinism.
Are we talking about melanin pigment here, or what pigment?
Yes, the pigment is melanin, which is present in the iris. Okay. Which I already talked about. So, in these cases, in albinism, you will see that melanin pigment is lacking, due to which you will see, as I already mentioned, the melanin pigment is giving color to the hair, color to the eye, color to the skin. So, here you will see that albinism, in albinism the children would be having, they are light colored, the hair are usually, they are all grey, and the iris is also of very light colored. Okay. They always, and usually it gives an impression as if it is red in color.
So, they do have visual impairment or no?
Yes, yes.
They have visual impairment,
yes,
because, and once you give them colored glasses, it can be...
Because the visual impairment is because the amount of light which is going into the eye is much more. Okay. Because the iris is not dark at all.
And this can be corrected with the help of colored glasses.
Yes, yes.
The person becomes absolutely normal with colored glasses.
Not exactly normal, but yes, at least the vision part improves.
Improves. Okay.
Yes, and you basically if they are the sensitivity to light improves. Okay. And they are able to see, at least in during when the light is comparatively not that blurred, or but it's when the light is too strong, the colored vision of colored lenses do help.
Okay. So, here we have talked about some of the causes. Madam has already talked about the anatomy of ear first of all, then she has talked about the causes, she has talked about the various tests which can be used for checking the vision. Then causes, she's talked about congenital causes, acquired causes, and here also she's telling some of the causes, in which she's mentioned myopia, hyperopia. Then she's talked about astigmatism, presbyopia, and albinism. I hope you've understood what these terms are, you've understood what the problem can be, how it can lead to visual impairment. If you have any doubt, you can call us at 26511 or 26511 You can also fax us at 26511 Here we are going to take a short break. We'll be back after a short break. See you there.